Today, I would like to show you Inguinal Canal. You can see here Inguinal Canal and the content of the Inguinal Canal. You know, the Inguinal Canal is one of the complex parts of the human body. So I would like to simplify it for you with these papers that I have built for my students, and it was so helpful. Yesterday we had a class. As you see here, you can see the pelvis. Here's the hip bone, right and left hip bone. Between the hip bone, you can find the sacrum, and you can see some ligaments. For example, here is the inguinal ligament. It links the ASIS, anterior spherical spine, to the pubic tubercle. And it's so important because we have a canal or inguinal canal here. Its length is 4 centimeters on the middle half of the inguinal canal, above the inguinal ligament. Sorry, we have inguinal canal here. So actually, inguinal canal, it's not a real canal. It's a passageway, some structures passing through this passageway between the anterior abdominal wall layers. So I use these papers instead of anterior abdominal wall layers. You can see here first layer, which is called external oblique aponeurosis. External oblique aponeurosis is made up of the dense connective tissue. It's the continuation of the external oblique muscle. Imagine that my hand is this external oblique muscle. It becomes the aponeurosis. And the lower border of the external oblique aponeurosis thickens, and it makes the inguinal ligament I showed you here. Here is the inguinal ligament. So inguinal ligament is the thickening of the lower margin of the external oblique aponeurosis. It also makes an anterior wall for the canal. You know, we have a inguinal canal, as I mentioned before here on the inguinal ligament, on the medial half of the ligament, we have inguinal canal. It's between the superficial inguinal ring and deep inguinal ring. You cannot see deep inguinal ring because in this view, from the anterior view, you can see anterior wall of the inguinal canal, which is made up of external oblique aponeurosis. So as a quick recap, external oblique aponeurosis makes 3 structures. Inguinal ligaments, it's the thickening of this aponeurosis, as I mentioned earlier, anterior wall of the inguinal canal, and it also makes superficial inguinal ring. You can see a ring here. You see the medial cross of the ring attaches to the symphysis pubis, lateral cross attaches to the pubic tubercle, and you can see here pubic crest. So here is the superficial inguinal ring. If I take the external oblique aponeurosis away, deep to this layer, we will reach to internal oblique muscle. You see here it is muscle, it's not aponeurosis. Internal oblique muscle attaches to the lateral 2/3 of the inguinal ligament. And this muscle, you can see, make a roof for the canal. Here is the canal. You can see some part of the inguinal canal above the inguinal ligament. So some muscle fibers of the internal oblique muscles make a roof for the inguinal canal. And here you can see aponeurosis. Internal oblique muscle becomes aponeurosis more medially, and this aponeurosis here in the lower border of the abdomen, it makes a tendon which is called conjoint tendon. Conjoint tendon attaches to the pubic crest. It is located just behind the superficial inguinal ring. So it supports the superficial inguinal ring posteriorly. So in a button line, internal oblique muscle makes a roof for the inguinal canal, and internal oblique aponeurosis makes conjoint tendon, which supports this superficial inguinal ring posteriorly. If I remove this layer, deep to the internal oblique muscle, we will get the transversus abdominis muscle. Like internal oblique muscle, some lower fibers of this transversus abdominis muscle make a roof for the inguinal canal. Here is the inguinal canal. So both internal oblique and transversus abdominis muscles make a roof for the inguinal canal. And similar to the internal oblique aponeurosis, transverse abdominis aponeurosis, you see here, make a conjoint tendon. So internal oblique aponeurosis and transversus abdominis aponeurosis, both aponeurosis contribute to formation of the conjoint tendon. As I mentioned before, conjoint tendon attaches to the pubic crest and adds support just behind the superficial inguinal ring. So transversus abdominis muscle and internal oblique muscles make a roof for the inguinal canal, and both aponeurosis make a conjoint tendon. If I take this layer away, back to this layer, we have fascia transversalis or transversalis fascia. Transversalis fascia make posterior wall for the canal. If you see here, the yellow paper is the posterior wall of the canal. So it makes the posterior wall of the canal. And it also makes an opening here. You can see it's the deep inguinal ring. So fascia transversalis make posterior wall of the canal, and it also makes deep inguinal ring. So as a quick recap, from the most superficial to deepest layer, you can see external oblique aponeurosis. It makes the inguinal ligament and anterior wall of the inguinal canal and superficial inguinal ring. Both internal oblique muscles and transversus abdominis muscles, they make a roof for the inguinal canal, and their aponeurosis make conjoint tendon, which supports the superficial inguinal ring posteriorly. And finally, transversalis fascia makes posterior wall for the inguinal canal, and it also makes deep inguinal ring. So in a bottom line, inguinal canal is located here. Its length is 4 centimeters on the medial half of the inguinal ligament between the superficial inguinal ring and deep inguinal ring. Superficial and deep inguinal ring. Its anterior wall is made up of the external oblique aponeurosis. Its posterior wall is made up of the fascia transversalis. Its roof is made up of the both internal oblique and transversus abdominis, and its floor made up of the inguinal ligament. So now you can appreciate anterior wall, posterior wall, roof, and floor of the canal. You can also find the You can also understand the conjoint tendon, how it can support the superficial inguinal ring. The final point that I want to add is that you see, if I remove the external oblique aponeurosis, posterior to the external oblique aponeurosis, we have internal oblique muscle. You cannot see the deep inguinal ring. Still, you cannot see, because it's behind the internal oblique muscle. So internal oblique muscle is a strong support for the deep inguinal ring. If I remove the internal inguinal ring, you can see deep inguinal ring. So anterior to the deep inguinal ring, we have internal oblique muscle, which acts as a strong support anterior to the deep ring. And we have conjoint tendon, which adds a support for the superficial inguinal ring posteriorly. Thank you so much.